Hey guys, welcome to the ICT 10 PCS coding series. If you are new to the channel, subscribe and follow the playlist from the beginning so that you understand all the concepts thoroughly. This is part 32 of the inpatient coding series, and today we will learn about the root operations in ICD 10 PCS. I'm Vinay Kumar. I carry an overall experience of 2 decades in the US healthcare industry with vast experience in coding, auditing, training, and mentoring. I have helped many professionals in preparing for their certifications, gaining knowledge, and also getting certified both from AHIMA and AAPC. I carry a certification from AHIMA, the CCS, and the CPC from the AAPC as well. At the end of this learning session, we will have a better understanding of coding the root operation transfer from the fourth group of root operations. We will also look at an example from the medical and surgical section. And remember, the medical and surgical is the biggest or the largest section in ICD-10 PCS. So if you master that, you'll master most of the root operations in PCS. Now, as you all know, there are a total of 31 root operations divided into 9 groups based on similar attributes of procedures, similar kinds of procedures grouped together. Okay, so today we are looking at the fourth group, which talks about root operations that put in or put back or move some or all of a body part. That's group number 4 in PCS. Now, there are 4 root operations in this group: transplantation, reattachment, transfer, and reposition. And today we are talking about the root operation transfer, which carries a character value of x. Now, as I said earlier, root operations are the most important aspect of building an ICD-10 PCS code. Remember, root operations define the objective of the procedure or the goal of the procedure. What exactly is the provider trying to achieve by doing this procedure? Always read the definitions, because sometimes you may come across multiple root operations which may sound to be correct for the procedure that you are trying to code. You have to read the definitions of these root operations, compare it, and see which one is the one that actually fits based on the goal of the procedure. This is the most important aspect you'll need to remember when you're coding root operations in PCS. Now, the root operation transfer. So, by definition, this is defined as moving without taking out all or a portion of a body part to another location to take over the function of all or a portion of a body part. So, basically, the transfer is to take over the function of another body part. The body part transferred remains connected to its vascular and nervous supply. It's not detached completely. Something called as a pedicled flap or a pedicled graft, wherein one end is cut off, but the other end is still attached to its original location. It's just a transfer. Now, a few examples of procedures that fall into transfer as the root operation: tendon transfer, skin pedicle flap transfer, local tissue advancement flaps, and pedicle flap reconstructions. Transverse rectus abdominis myocutaneous flap is what we call it. Okay, these are examples of transfer. Now, a couple of things you'll need to remember when you're coding transfer as the root operation. For procedures involving transfer of tissue layers like the skin, the fascia, and the muscle, here there are multiple layers of skin involved, right? So in this case, the procedure is coded to the body system value that describes the deepest tissue layer in the flap. Now, if the flap is taken up or lifted, if the skin, the subcutaneous tissue, the fascia and muscle all together, until that depth is what the flap is lifted, you need to code it to the deepest layer that is involved. That's the basic point. Okay, now when they transfer tissue transfer is composed of more than one tissue layer, the qualifier can be used to describe the other tissue layers. Okay, so this is one important point, code to the deepest tissue described. Now, the other one is for transfer procedures classified to other body systems like the peripheral nervous system. For example, the body part value specifies the body part that is the source of the transfer, which is from. And wherever qualifier values are available, they specify the destination of the transfer, which is the to. So from where to where is the transfer being done? Okay, we'll just have a look at an example related to this specific coding guideline. So the root operation transfer is used to represent procedures where a body part is moved to another location without disrupting its vascular and nervous supply. Now, in the body systems that classify the subcutaneous tissue, fascia, and muscle body parts, I'm repeating again, a qualifier is used to specify when more than one tissue layer was used in the transfer procedure, which means the deepest layer should be coded. That's the basic point that I'm trying to make here. Okay. Now, let's look at an example. So, this is an example of the root operation transfer. The patient undergoes nerve surgery to prevent a residual claw hand injury after injuring his left hand. So, an anterior interosseous to ulnar nerve graft is accomplished via an incision using an operative microscope, and the interosseous and ulnar nerve are brought together without dissection. So, if you read carefully, this is basically transfer of the anterior interosseous nerve onto the ulnar nerve. Okay. Now, this is the corresponding table that shows the transfer of the anterior interosseous nerve onto the ulnar nerve. Section is medical and surgical. Body system is peripheral nervous system because we are talking about a procedure of the nerves. And the root operation is transfer. Now, for the body part value, the value is taken as median nerve because we spoke about the body part key in the previous videos as well. So, in the ICD-10 PCS coding manual, now in this case, I do not have the anterior interosseous nerve listed as the body part for the fourth character, right? So, I have to go to the body part key and search for anterior interosseous nerve. Okay. Now the body part key is leading to median nerve as the body part value when I search for anterior interosseous nerve. Okay, because anterior interosseous nerve does not have its own distinct body part value. And there is a guideline in ICD-10 PCS as well, which states when a specific branch of a body part does not have its own body part value in the PCS for the fourth character, the body part is coded to the closest proximal branch that has a specific body part value. You can use the body part key to search for anterior interosseous nerve. It will lead you to median nerve. Or otherwise, clinically or anatomically, if you think about it, the median nerve is the closest body part value. Okay, I would say go by the body part key, which would be an evidence that you are coding it right. So the body part in this case would be median nerve, and then the approach is open because an incision was made. The sixth character is no device because no device is being left in place after the procedure. And for the seventh character, the qualifier would be ulnar nerve because the procedure is about anterior interosseous nerve being transferred over to the ulnar nerve. As I said previously, the body part value is the from, and the qualifier value identifies to where the transfer is being performed. In this case, the ulnar nerve. So the code for the transfer of the anterior interosseous nerve to the ulnar nerve is 0, 1, X, 5, 0, Z, and 4. So the key points that you need to remember from this video. For procedures involving transfer of tissue layers such as skin, fascia, and muscle, wherever multiple layers of skin are involved, the procedure is coded to the body system value that describes the deepest tissue layer in the flap. Okay, and then for transfer procedures classified to other body systems such as peripheral nervous system, the body part value specifies the body part that is the source of the transfer from where the transfer is being performed, and the qualifier values identify the destination of the transfer to where the transfer is being performed. And then another point you need to remember, all free grafts are coded to the root operation replacement and not transfer. Transfer is one end of the body part is still attached to its original location. But replacement, the entire body part is removed and moved out to another location. This is the difference between transfer and replacement. You'll find the online version of the ICD-10 PCS coding manual from this link. I have placed it in the video description as well. Once you get this link, just click on the zip file which contains the code tables and index. That will be the actual PDF where you can start searching for the codes. Thank you guys. Thank you for watching. Please subscribe and support the channel if you have not done that already. And follow the complete playlist for the entire set of videos for the ICD PCS. I'll also do the CPT and ICD-10 CM videos in the next upcoming weeks. Thank you.